immediately I got off the matatu at the main bus terminus, people were talking in low tones about me and asking, this one who has come in a mask, where is she coming from? And as I also went to take a cab to take me where I was going, the same everywhere I went behind me, they were saying, huyu na yeye amevaa mask kwani ametoka wapi? Ama ni mgonjwa. And just last week on Friday, I also went into a matatu. And the conductor in the matatu was asking me, kwani wewe hujawahi sikia watu waliacha kuvaa mask ama wewe ni mgonjwa?
A very good morning to you. My name is Melissa and AROKA. Thank you so much for joining us this morning on AROKA Media. As it is, we are going to be talking about COVID-19. It has already been found that in Kenya, we are behaving as though it is no longer there. But you know what? We're still reporting deaths. We're still reporting those who are actually sick. And we need to do something about it. With me is Nairobi Metropolitan Services Health Promotion Coordinator Lillian Mutua, who has been out and about, getting Kenyans to actually be vaccinated. She's always been out there in the field, just reminding you why you need to do what in order to keep away from COVID-19. She visits us this morning, and I'm so glad to have her on the show. Impact. Karibu sana.
Asante.
Thank you so much for coming to Machakos County.
Thank you.
Now, it's really nice to have you here, and I want us to just start with the facts, because as Kenyans we're not getting serious, and this is not so good because we are risking our lives, and I want you to just get to the facts, There were so many people who are getting vaccinated, especially when the COVID wave was so much in the country. But now the numbers have gone down, and I just want you to give us, in details, what percentage of Kenyans have not been vaccinated.
As we well know that Ministry of Health and the national government had geared to getting 70% of the eligible persons in Kenya to be vaccinated by June 30th. But up to date, we did not make up to that 70%. Thus, the extension of the time to December 31st, that we should have 100% of the eligible population being vaccinated. That is 100% of all adults and 50% of the teens who are between 15 to 17 years. So we have also stepped up again, like we were doing before, to get the eligible population being vaccinated. And this is being done through different strategies. We are using the static clinics which provide the COVID vaccination. We are also now going out into the population, into the community, to rally the call for people to get vaccinated. We are also educating people on the benefits and importance of getting this vaccination. So as much as Nairobi would be doing well, but as a country we have not reached 50%, because we have other counties which are doing even less than 10%. So we really require the eligible population to get vaccinated, because if this happens and we are at least 90 to 100% of these people getting vaccinated, then we will know that we have created what scientifically we call the herd immunity. Where you have most of the people vaccinated, it means they are already producing antibodies against the disease, and they are able now to fight the disease.
Lillian, I'd like us to talk about the importance of the vaccine, but I'd like to, take you to something that is so close to your heart. It's even taken us a while to be able to talk to you about this, because I can remember very well that you used to go around and really educate people about how to avoid getting COVID-19 and even the measures that people need to take. And then we just woke up one morning and you had lost your mom to the same COVID-19, and I could feel that you were so broken about this. Perhaps we also have those people who need to hear, of such stories, and what exactly happened. Because I remember you saying that your mom passed on after she had attended a funeral where you had seen some red flags. Could you just take us back to that, and maybe even tell us some of the red flags that you had seen that had, if something had been done about them, perhaps we would not have that situation today?
Well, I happen to have lost an auntie of mine who is older than my mom, and everybody was going for the burial. But I remember us having a conversation with my mom, and I told her since I was working, I would not be able to attend. And in my family, of those who went to the funeral, my two sisters and my mom got infected. And that's why I always count on a funeral, because apart from my mom and my two sisters, other people also got the COVID. So when we are being given these measures, we need to take them seriously. Because if from that funeral in a week or two, people were complaining of the same symptoms and they had been in the same place, then I should say that that was a prime location for a community transmission. And when you have a member of family who has passed on, you'll first even go and give condolences with the family. So within that family, you'll have meetings. You'll go for the mass or the church service before the burial. So if one of you had this COVID-19 virus, then it means you'll continue spreading to others unknowingly. Not that because you know, but unknowingly. Maybe because you also don't have the signs and symptoms. So with time, it's only that when one of you becomes very sick and they test positive and you let word out, then the others will start saying, okay, I think even the symptoms I'm having could be of the same illness, let me rush and take. So in this incident, most of my close relatives also got infected. And sadly enough, my mom was a bit unwell, and she was also hypertensive. And the first time she complained of just having a headache. And it's a headache that after she took some painkillers, it went off. But after 2 to 3 days, I could hear her talk and find that it's not the normal conversation that we normally have. She went to the hospital, she tested negative. But since she was not going home immediately, she had to stay. After another 4 days, she started saying she had a sore throat and a cough. And we repeated the test again, and this time it was positive. For the sister who was staying with her, my youngest sister, she also ran a test. She was also positive. So my mom was already becoming a bit breathless, and she had to be admitted to hospital the same day. My sister too. And in 3 days, we lost my mom. But I do only say remorsefully that it's sad that she passed on before the vaccines were here in Kenya. Because from that time when the vaccines came in, I kept encouraging each and every other family member, both the nuclear family and the extended family, relatives, friends, and colleagues to continue getting the vaccines. And at times it's very sad because 2 of my sisters who tested positive could not even attend the funeral. They didn't put our mom to rest. And it's not easy for them even now to just those last moments are very important in one's life. So it's sad that they could not even attend her funeral. For the larger family, we even had restrictions, like the government had said. We could not allow more numbers that were not requested to come in. And this is why we need to look at the measures that are put in place by the Ministry of Health. Because if that does not happen, then it means that most of us are going to suffer. And if we've been given some communication by the government, it's good for us to follow on that. For my mom's other siblings and close relatives who have had their vaccine and they have gotten COVID, especially those who are 70 and above, some of them also living with other illnesses and comorbidities. it is not very easy. For my mom's relatives who have gotten the COVID vaccine and have been vaccinated and have suffered COVID-19, they've not been as serious. Even the ones who went to hospital, they went to hospital and went back home. So for us, we say that as a family and even larger family, we know the importance and the benefits of getting this vaccination. Personally, when I count people who I know, people who are very close to me, including the family members, my colleagues, my friends, people I go to church with, people I've grown up with, I've lost, up to last week, I've lost 25 people who are close to me. So when I have the passion of doing whatever I'm doing, I'm just doing this so that I can help people make informed decisions and save each and every other life.
Lillian, if I remember correctly, a few months back, you also got to have COVID-19. Perhaps you could give us your experience now as a person.
It's very interesting that I got COVID-19 in January this year. I'd been still doing my field work for 2 straight years without any signs and symptoms. And being on the forefront of meeting with the communities, educating people, mobilizing people in the field to go for the vaccination. So for me, this is a daily job. And for all this time, I was well until I woke up one morning and I could not sustain a conversation on phone. So one morning I just woke up, I could not hold a conversation on phone. The first person called, but I could not make do with the first sentence. I tried again, I could not, and I had to put the phone off and text the person and ask them to talk to me on text. So we had a conversation on text, but I didn't know what was happening. Then immediately I was walking out of my house to go to work. I got another call. I could not still sustain a conversation. So I always say it's good to listen to your instincts and to listen to your body. So this was on 3rd of January. And I remember that the previous 3 weeks was very intensive. We were doing outreaches, and I was very much involved in the CBD. And I was also doing a lot of support for the teams which were doing vaccination before the 31st of January. So something just clicked and said, I don't have a cough, I don't have any issue with my throat, I don't have a sore throat, what could be happening? So my instinct just told me it's good for me to go and check whether I could also be having an infection, because I remember in the night turning and tossing a few times. I was just feeling uncomfortable, and especially on turning and tossing and feeling uncomfortable, and especially on my back. But I didn't think it was a big issue. So I just walked into one of our public facilities and requested to be tested, and the test was taken, and interestingly enough, I had COVID. And you can see it's only that I could not sustain a conversation. So if I would have taken it lightly, maybe I could have spread it to other people without knowing what was happening. So immediately I was told that I turned positive for COVID-19. I had to call my supervisors and my team and let them know that I've been tested positive for COVID-19, and I was taking a break just to go and isolate myself.
Wow. We've talked about what you felt that made you want to go and find out exactly what was happening to you. Let's just take it back to whoever might not be knowing about this, or perhaps remind them of what the symptoms are that when you see you need to really go to a facility and find out whether you might be having COVID-19.
So for me, I'd like to say that we have the cardinal signs, which could be the cough, the breathlessness, the chest pain, headache, fever, just feeling like you are lost of energy. And it also could be accompanied by symptoms which are not within those. So it's very good for you to listen to your body, and anytime you're feeling that you're not well, and especially when we are experiencing a wave of COVID-19, not to self-medicate, but rather go to a health facility where you can be listened to, where they can do some correct diagnosis, give you appropriate medication, and if need be, even have the COVID-19 test done. So it's very important that we stop self-medication over the counter. We stop asking our friends, when you had COVID, what did you take? Because I think I have the same symptoms.
Yes.
The best is to go to a healthcare provider who is certified in a recognized public or private or faith-based institution where they can look at what you're having, and then you'll be guided the right way.
Okay.
For those who turn positive, we've also found that because we normally make calls just to check on how they are doing, we found that when you're calling someone, the background is not at home. You can hear maybe a lot of noise around them, or maybe you can just listen and know that is a working environment. We request, if you have COVID-19, it's not a stigmatizing infection. Just be isolated. Stay at home so that you don't infect others. Put on your mask. Keep some distance. And if really you do not feel like you can stay at home, kindly have your mask on, but just know that you'll be doing disservice to the rest of the community, your own family, friends, and workmates.
Talking about masks, you've been out there in the public, and I just want you to tell my viewers about your experience, having put on masks in a public place and how people have, reacted towards it.
It's good that today I'm in Machakos County. I remember last month I went visiting a family member in Machakos, and in fact in Machakos town. And immediately I got off the matatu at the main bus terminus. People were talking in low tones about me and asking, this one who has come in a mask, where is she coming from? And as I also went to take a cab to take me where I was going, the same everywhere I went behind me, they were saying, huyu na yeye amevaa mask, kwani ametoka wapi? Ama ni mgonjwa? And just last week on Friday, I also went into a matatu, and the conductor in the matatu was asking me, kwani wewe hujawahi sikia watu waliacha kuvaa mask, ama wewe ni mgonjwa? So when
like
people say that,
this is what now shows you're a sick person.
Exactly.
Okay.
So they stigmatize you and think the issue is with you. They don't think that you're preventing yourself and preventing others. And even if I was sick, it is right for me to have a mask.
Yeah.
But for me, I will always put on a mask to protect myself. And just in case I have the infection, I'm also protecting the larger population.
Wow. Lillian, let's talk about the vaccines. For those who maybe have not gone for this vaccine, how is it administered?
So the first thing I should tell people is that when you're going for the COVID vaccine, if you're able to register yourself online at the mchanjo platform, which is a website for Ministry of Health, you just go to the Google and type in mchanjo website and then self-registration. You'll be able to key in all your details even before you reach the vaccination site. And that is what also our data clerks do when they are on the vaccination desk. So you register yourself there, and when you reach there, they are able to ask some questions like whether you've had any allergy for any vaccination in your lifetime, whether there are some drugs that you use or not use, whether you have any allergies, whether you have any medical conditions. And this is just to triage and just to get your history before you give you the vaccination. Then you're given the privilege to look at what vaccine would you prefer to get. We know very well that for the teens, people below 18 years, they are getting Pfizer. Why Pfizer? It's because it has been tested with that age group and found to be okay for them. Then the other population, you can use either of the vaccines that is of your choice. We have the AstraZeneca right now. Moderna is out of stock. It's been out of stock for quite some time. Those who had gotten the Moderna can still mix and get their second dose for another. We also have Johnson & Johnson, So we are privileged that we have most of the vaccines with us.
I want you to go back to the mixing part, because when uh, this whole thing was starting, people were told you're not supposed to be mixing the vaccines. Have things changed now?
So what we are saying is that currently you have to finish your schedule of the first dose. So if you have had your AstraZeneca, which is repeated after 8 weeks, if you are having the Johnson and Johnson, which is only a one-stop shop, if you're having the Pfizer, which you have a jab 4 weeks apart, if you're having Sinopharm, any of these vaccines, it has been researched, tested, and tried that you could mix after you've completed your initial schedule. But if you got the vaccine and got maybe some side effects and you need to change the vaccine, then when you are going for your second dose, you can also change, but this will be discussed with the provider. The medic will be with you and you know what you should get. What we really emphasize is for those who have gotten their first dose and needed to do their second, and they're in their schedule of getting the second but have delayed, would they kindly go get their second dose? Because unless you finish your schedule, then you're not fully vaccinated. You need to boost your immunity by getting the second dose so that your body is reactivated to continue producing more antibodies.
Now, Lillian, could you talk to us about perhaps some of the side effects that we can expect when one gets the jab? Because we've had instances, for example, there's a woman that I interviewed, Jane Francis, who talked about the fact that she had cancer, and after she had the COVID jab, then she started having certain complications. She could not stop bleeding and stuff like that. And I'm sure that we have other people as well who got the jab and then perhaps, something came up in their lives. Let's talk about this and perhaps the importance of going for tests, maybe, when someone does not feel right after the COVID vaccination.
As for the side effects, not everybody will experience the side effects, but some might get some headache, some general body fatigue. Others say they have pain on the site of injection. So all these side effects are not common for everybody. Some people get them, some people will not. So what we normally ask is that if you have taken the vaccine and you feel like you have something that is very much way out of the normal, the best thing is maybe to visit the facility. Apart from maybe if you're having some headache, which could take a pain killer or an analgesic, if it doesn't go away, kindly go to the health facility. If you're having pain at site of injection, you also take the same analgesic or painkiller. If you're having fatigue, kindly just take some rest, because it is the response of your body to the vaccine that you have been given that could be triggering whatever that you're feeling. But if you have very severe headache that does not go away, even if you take medication, then that is an alert sign that you need to go to the hospital. If you feel like your energies are also very low, you've rested, you've taken a lot of water, nothing is happening, kindly go to the hospital. Let them know that you've been vaccinated and this is how you're feeling. But what we should tell people is that whatever else that you get and you feel your body is way out of the normal, kindly visit the nearest hospital, because most of the people have confused the way their body feels and the vaccine. They always think that it is the vaccine. So supposing you are going to get something like a bout of a malaria attack, it might have started even before you got the vaccination. But for the signs and symptoms to come in, then they come in later. Maybe you are developing a chest infection and you've gotten the jab. The jab does not prevent you from getting other illnesses. It can only prevent you from getting severe COVID-19 sickness or illness. So if you get the vaccine and have any other issue, kindly go to the facility, be checked, let them come up with a diagnosis and management. For the lady that you interviewed, it would be also good for you to follow up with her and ask her whether she has gone to the hospital, what became of her issue, whether the issue had been resolved, because you can see she already had an infection that a condition that she was living with. Maybe it has progressed and she is confusing it with the issues of the side effects of COVID-19. So it is just good for you to get to a facility where you have someone certified to look at you, know what is happening to you, and let them discuss and get it managed.
So the main aim of this interview actually is to accelerate the numbers of those who go out there and get the vaccine. Like I told you earlier, I'm going to give Lillian Mutua a few minutes to just tell us the importance of having this vaccine. Lillian, why is it so important that we get vaccinated?
So when you're getting the COVID vaccine, let us always remember that it's not preventing you from getting the COVID illness. What it does is to give you the benefits of your body developing immunity, that is the antibodies that will prevent you from getting severe COVID-19 disease, and also staying away from hospitalization or getting complications out of COVID-19. So we must get this vaccine so that we are at ease. In event that we get infection, we shall not be very severely sick. So we must encourage those who are having children 15 to 17 to get them vaccinated. This one specifically get the Pfizer vaccine. They will get their 2 jabs 4 weeks apart, and then they'll get a booster dose. For the pregnant women, kindly get the COVID vaccine, because if you get the COVID-19 disease and you are not vaccinated, then yourself, you're in danger. You also put your pregnancy in danger. Most of the women who have gotten COVID-19 without getting vaccinated and they are pregnant, they have lost their pregnancy. Some have even lost their lives following the COVID-19 illness. For the elderly, it is very important for them to get the COVID vaccination. Kindly, if you have an elderly person who is near you or close to you, kindly help them to go to the vaccination center, have them vaccinated. Also look at the date that they need to resume their second dose and keep a reminder, and even help them to get their booster dose. For the rest of us, kindly visit the nearest COVID vaccination facility, or as per now in the whole country, we are having teams that are moving within the communities offering the same. You will identify those who are in Nairobi, and specifically talk about Nairobi where I work. They are in aprons which are yellow and they are written COVID-19. You can also ask them any pertinent question on COVID-19 or COVID vaccination. If you have any other question and you are within Nairobi, or you want to know any information about the vaccine or the COVID-19 disease, it could be also any other emergency or a disaster, kindly get to us through the NMS hotline number at our Emergency Operations Center, that is 1508. You shall be assisted.
So Lillian, you say that right now you have your teams on the ground and they're going into the community. Could you specify exactly what you mean by community so that people can understand where to expect you guys to be at?
So you'll find us walking into the estates, in the informal, into the villages. You'll find us walking to churches, to workplaces, to social amenities like the malls, the shopping centers, the markets, the bus stops, and the matatu terminals, and also the border stages. So if you see these teams walking around, kindly get close to them, have your vaccination. It could be the first, second, or booster. And also, if you're an organized group, I will still insist that you can still call on 1508. Tell us where you are, tell us the number of people who want to be vaccinated. Is it the first, second, or booster dose? And we will be glad to give you the services.
Amazing. So you've heard that. If you're an organized group or you know a place where you'd love for them to actually come and have you vaccinated, then they can always organize that. Thank you so much for coming to the show today on Impact, and of course giving us this information. There's so many Kenyans who do not know exactly what's happening right now, the status of the country, and the fact that we still have COVID-19. She's even told you how, you're even stigmatized for being the only one in a mask. But go ahead and do that, because you might just save your life. The numbers will be rolling there on the screen on just which number you can get to call if you want that organized vaccination to be done where you are. But plus, you can also go to the different health facilities where you'll be able to be vaccinated. As it is, as a country, we are less than 50%, but we've got to raise that bar for our own sake, so that we are not affected by COVID-19 as it has happened in the past. Thank you so much for coming to the show. That was Lilian Mutua. She is the Nairobi Metropolitan Services Health Coordinator, and she'll be giving us more information. Like she has said, every other time something new comes up, we need to keep telling you, so that you can also get to know exactly what to do. Just like when we were starting, you could only take one particular type of vaccine, but now she's saying that you can get to mix, those kind of things. We need to keep telling you about them regularly, and we will. My name is Millicent AROKA. Do like, share and subscribe to this channel. Plus, you can leave a comment right below.